There's something about Oklahoma. We don't just see problems. We strive for solutions. And when we face challenges, from the Dust Bowl to terrorism to storms and hardships, we're there for our neighbor. Today, our neighbors are hurting. Neighbors across the street and across the country are battling an epidemic that is rising. Diabetes is one of the greatest medical concerns in America. From 5.5 million Americans diagnosed with diabetes in 1980 to 34 million in 2020. 1 in 8 Oklahomans have type 2 diabetes. 1/3 of the state's adult population has pre-diabetes. Native Americans are twice the risk. And at the Hamm Diabetes Center, in the heart of Oklahoma, we are working every day to find the cure.
The trend line is not looking good. It's not slowing down. There's probably over 500 million people worldwide with diabetes. So it's spread across the world. The 1 in 3 people with pre-diabetes has actually started to filter down to children and adolescents. So it's starting earlier and earlier.
There's a lot out there that we know about type 2 diabetes in adults. Type 2 diabetes in kids is a different monster. From our studies in today, more than half of them fail their treatment. The complications that arise from this youth onset diabetes are so aggressive. We have to intervene. We have to figure out what's causing it. We have to figure out how to stop it.
Diabetes today is an epidemic, and we needed to create something here in Oklahoma to address that. And that spawned the Hamm Diabetes Center. There are lots of people around the world trying to find this cure. It's really a matter of sort of like drilling for oil. You're putting holes in the ground and hopefully come up big. So we've invested our resources in what we can do here in Oklahoma, specifically in that first 1,000 days. We've also invested in protecting your pancreas, which is both a type 1 and a type 2 problem. And then we've tried to look closely at why people with obesity and diabetes have more cancer risk. So there are a lot of places to look. The only way to get a cure is to find a cause. And the causes will be revealed by our research, and we're getting better and closer every day.
I firmly believe there's not a better place in the country to be positioned as a clinician, as a researcher, as an educator, than to be here in Oklahoma City, here on this campus now.
Physicians that you'll encounter here are at the cutting edge. They know what's on the horizon and can give you the best care. And technology has changed so much in diabetes just over the last 5 years. New drugs have come out, and the access to those and how they're used and the research that goes on with them takes place here at the university. So that makes what I think for all these people with prediabetes and diabetes want to look towards, where's the expertise? Where's it coming from? And it's actually right here.
All of this coming together to really make sure that we have the ultimate environment for patient care. Now, on top of that, we're also able to offer these really unique opportunities into research, into clinical trials that are available nowhere else. And it's really those clinical trials, that other research that moves what we know forward to provide better care, to provide better outcomes.
There's nowhere else that all of this research is really being done with the clinical care at the same time than at the Hamm Diabetes Center. So having all of that together in Oklahoma happening at the same time is key.
We are here in Research Park intentionally because of the investments being made across the street. And there are a lot of people taking a lot of risks to invest in this. And we're here to ensure that we steward those investments towards something beyond what any of us can imagine.
This is the place to be if you have diabetes. The most cutting edge treatments, the most cutting edge research is here. And that is what we need to cure, to prevent, to treat. Diabetes is stopping. The question is,
In Oklahoma, we don't just see problems, we strive for solutions. We believe that remission is possible, and the ultimate cure for diabetes will come from right here. It'll take all of us, and we know you can help. Join us.